Anyone else take their shirt off when they do CPR? I saw this earlier. You guys on Reddit are literally just crazy, crazy. So basically, I'm 7-0 resuscitation shirtless. It didn't start out like this. Usually, I just stand in the back and look concerned. But 2 weeks ago, I had to step up and do chest compressions. Patient number 0 shot all of his CCHO pancakes all over my button down after being defibrillated. Naturally, I removed my outer layer and did CPR in just a white beater. I'm not trying to brag, but I've been working out with the ortho bros, so my triceps show some great tone while locking my forearms for these compressions. Anyways, immediate Rosk. Much like Tom Brady wearing the same socks for 15 games straight, I've been walking into codes shirtless now, and wouldn't you effing know it, Rosk every time. Honestly, I feel like I'm doing a disservice to my patients keeping my clothes on. Anyone else have this issue? This stuff, the freaking meme content that you guys come up with here on r/residency is just insane. You guys, like, honestly, I don't doubt that this probably did happen on the first one, and then he just like came up with this crazy story. Who needs epi when you see shredded pecs? Like, goddamn. It's part of the new ACLS criteria. Only after 3 rounds of bicep flexing have failed to restore a perfusing rhythm. It's even in the name, right? Asystole, compulsory loss of shirt. An attending shitpost. Interesting. +1. 3 out of 5. Great work. Only way to resuscitate is a visit to the gun show. Seriously though, I generally make it a point to help people shed their name badge and the stethoscope around their neck. Nothing worse than those flopping around. I totally actually agree with that. That's actually a really good point. Like, so many times we go in and do like procedures or anything that's going to require us to actually physically be doing things. You should really take off your jacket. I actually do. I take off my jacket all the time because it gets really hot. Especially the lights shining down on you, and then if you're doing CPR especially, you're gonna get hot, and then all this stuff flopping around, you want to get all of that off, so you want to take all of that off before you do anything. This is the type of quality content that r/residency is renowned for. LOL. Rosk when they see these abs. So this guy, Mike Ginny, he's here. He always puts his PGY year here. He's an attending. He's PGY 18. He says, some of your colleagues are gay. Stop this. We're getting hot under the collar. And then this person says, me in the corner hoping my heart stops next. This person says, I can't even tell if this is a parody or not. This is definitely a parody. But I don't doubt that people take off their shirts, not completely shirtless, but yeah, doing it in a white t-shirt, yeah, that's totally reasonable to do a CPR in a t-shirt. I saw this other post the other day. It's got 1,900 upvotes, and it's I know nothing about medical care. Ask me anything. And this guy, I only read the first few ones, but this guy was like hilarious. This sub got recommended to me so much that Reddit must assume I'm some kind of medical professional. I guess watching some Grey's Anatomy counts as training. Ask me anything medical related, and I will give you 110% true and accurate responses. The audacity of this normie to show up and outshine every July intern ever. This is, I didn't see that post earlier, but it's totally true because every July intern is so scared and so nervous. And you have that huge imposter syndrome. And then this guy comes along and like has no medical knowledge at all. And, but the confidence to show it. So it's pretty nice. What's the number 1 risk for having a stroke? Being alone at home. That's actually like a very good answer. I feel like that might be a risk factor. We should actually do a randomized control trial and see if that's actually a risk factor. Knowledge checks out. You are a resident. Don't lie. I can't be a resident. I'm happy. What is your preferred approach for critical hyponatremia related to beer potomania? Please reply quickly. This guy is in bad shape. Tell him to have some pepperoni pizza for his salt situation. It's got plenty. It's actually kind of funny because taking some pepperoni pizza with the beer probably would help this person's beer potomania. So again, this answer is not that wrong. Beer potomania being, that condition where you are literally just relying on all your calories from beer, and so you have no solute and you don't have any salt. You're just drinking like fluids all the time. So your sodium levels go down and you get hyponatremia. So if you actually started supplementing with some pepperoni pizza, that actually would resolve your issue, at least partially, of the beer potomania. Now, obviously, it's not going to be a great diet, but it's actually not that wrong of an answer. It's actually pretty good. What do I do for my Peyronie disease? Peyote. I actually don't know what that. It's some kind of food, right? Peyote. A small spineless cactus. Interesting. Peyronie disease is that one where like people's penis starts getting like bent all out of shape from like fibrous scar tissue and stuff like that. Can you explain the Krebs cycle? When two crabs love each other very much, the male will fertilize the female's eggs, leading to a new generation of a crustacean infestation. This is actually insane, this guy's level of humor. I'm not somebody who's particularly humorous, but there's like no way I could come up with something like this. And so having somebody who actually is not in the medical field and doesn't, know the typical things that we think of when we hear about Krebs cycle, it's pretty just entertaining to hear what people have to say. How would you repair a mitral valve? Carefully, I would hope. Where's my dad? If you're a doctor and your dad still hasn't come back to ask you for money, I don't think I can offer any further advice. What is a spleen? It's a no danger balloon that kills you very fast if it pops. This is generally more than I knew before med school, so props to you. You should watch more Grey's Anatomy, doc. How do you work up a cyanotic infant? Throw on James Cameron's Avatar so they can learn about their people. Oh my god. There's no way one single person can be this funny. I honestly don't understand who this person is. This guy has to have some medical knowledge. Like, I don't know. Or there's some kind of stand-up comedian. Like, how do people even come up with this stuff? It's actually insane. Thanks, Opt, for the funniest thread I've ever read on this sub. There's many other things here that are very funny, but they are actually quite inappropriate as well. But honestly, this is a very entertaining thread that, I think is kind of that dark humor that medical professionals definitely appreciate. These are very serious situations, but sometimes you do need to make light of some of these difficult situations. And then, somebody like this comes in, he's just caused a ruckus in the r/residency subreddit. Based on what you've read on this sub, what specialty would you do and why? Hospitalist, since I hate working hard. Listen here, you little shit. Follow up, which specialty would you least want to do and why? Cardiology. I just don't have the heart for it. My patient has been fully dilated for 3 hours and is refusing to push. What should I do to deliver the baby? Sorry to break it to you, but if they won't push, you gotta pull. God damn, I'm also non-medical, but your answers are hilarious even to me. Can I use a balloon dilator down there? This is a delivery, not a birthday party. Technically, it's both. Oh, this is awesome. F, marry, kill, specialist edition. F, plastics for obvious reasons. Marry, dermatology for the lifestyle. Kill, radiology because AI will replace them anyway. Damn, bro. This guy's like spitting fire over here. What's the powerhouse of the cell? The mitochondria. That's easy. Why the F do we all universally know this? It is the only thing anyone retains from high school biology. Do you prefer rate or rhythm control for AFib? Rate without rhythm is like a sandwich without bread. Doesn't matter how fast your moves are if they're uncoordinated. Hope this helps. There's something kind of profound about some of these answers, to be honest. Like, it almost makes you think, are we managing things correctly, or should we be like doing things with rate and rhythm control? Like, because it's actually a legitimate question that we have of doing more rhythm control these days. Yeah, r/residency has actually been kind of insane recently. There's been this whole like day in the life or diary of EM resident or surgery resident. So I'm gonna have to go over that at some point too. And I wonder if it's because it's like, February ended, the February blues, where everybody starts to feel kind of sad. It's kind of already passed. And it's like, maybe everybody's just like full energy is just coming out now. And that's what we're seeing in the subreddit now. Anyways, we'll take another look at some of the other threads and posts in another video. Thanks again for watching. I'll see you in the next one. Peace.